So first off, what are probiotics? So probiotics are essentially live bacteria in a pill that you put, you either swallow them or you ingest them, and the thought is that it's supposed to change or adapt your gut microbiome to give you the healthy bacteria that is there and to hopefully rebalance what is going on. And what we think could be going on for a lot of individuals is that there's an imbalance of your gut microbiome. There's too many bad guys, too many inflammatory bacteria, and too less good guys. And when you have that imbalance, that can cause bloating, distension, gut issues, diarrhea, or constipation. And sometimes we can maybe see manifestations with skin issues, joint issues, brain fog, and things like that. So the idea is by giving yourself a probiotic, either in a pill or a food form, you can change that gut microbiome, make it normalize, and get things better. And this is why people take probiotics when it comes to pills. So what exactly are we doing when we take a probiotic? Well, what we're doing is that we're hopefully trying to adapt and change that gut microbiome. Your gut microbiome is such a unique environment for you and your individual person, and it can be different for every single individual, even within the same household, even if you are related. So many factors play a role when it comes to your gut microbiome. Previous use of antibiotics, whether you were delivered cesareanly or vaginal delivery, whether you were breastfed, the types of food that you had in the past, the types of food that you eat now, stress, sleep, whether you live in the United States or elsewhere, what type of foods that you eat, what is the makeup of that foods, the fibers content of those foods, whether you have foods that are very processed. There's so many factors that play a role when it comes to your gut microbiome, that my gut microbiome is different from your gut microbiome, and it's different from your kids as well. And so what is the evidence? Who should take a probiotic? So I am the type of doctor that's going to give you information that's based on clinical science. And what we know so far is that we don't have a lot of good evidence that probiotics play a significant role in terms of determining your gut health. What we do know is that certain individuals, so for example, if you've had ulcerative colitis, you have what's called a J pouch, which is a pouch you have after a certain surgery, that probiotics tend to help decrease your risk for a condition called pouchitis. We also know that for some IBS patients, or those who have irritable bowel syndrome, probiotics may play a role in changing your gut microbiome to make them feel better as well. We do think that somehow probiotics can play a role sometimes when it comes to fatty liver, when it comes to other conditions as well. What we don't know is exactly what role that plays. What we don't know is that we don't know exactly how much of a role that will play when it comes to your long-term health, and whether there's going to be any problems when it comes to your long-term health as well. So we don't have a lot of good science behind that. My best analogy I give to my patients, there's a whole lot of marketing when it comes to probiotics with a sprinkling of some science behind that. So the biggest question is, all right, if we don't have a lot of good information for probiotics, and we don't know exactly if we don't know exactly what is going to be, what the effect is going to be, what are my thoughts when it comes to taking a probiotic? And here's what I would say. Like any type of supplement, probiotics are not they're not regulated. And so like any supplement that's out there, we have certain regulatory forces that are out there that allow us to determine if something is going to be the best thing for us or not. And also too, we use these regulatory bodies to help us determine what the long-term side effects are and what the long-term studies are for these particular medications and treatment as well. We don't have these regulatory bodies when it comes to probiotics and other supplements as well. And so having said that, we don't know exactly what are going to be the best probiotics for each individual person. What we also don't know is what is considered the best probiotic. So a lot of people ask me, what do I recommend? What I would say to a lot of my patients, number one, speak to your doctor about whether you should be on a probiotic, because they typically are safe in a lot of individuals, but there are some case reports we have out there of probiotics actually causing a lot of harm to people who actually may be immunosuppressed, who may be on steroids, who are on cancer treatment, and actually you can have a really bad systemic reaction. So number one, like all supplements, speak to your healthcare provider. Number two, I would recommend going to a very reputable, well-named company to try and get your best probiotics. And there are a lot of companies that are out there that are big pharmacy companies that are known to have a good reputation behind them. Johnson & Johnson has great probiotics. We know VSL has a couple of good probiotics. And there are a lot of good probiotic qualities that are out there for companies that would make me feel more comfortable to get a probiotic from that particular company. And there are millions of probiotics that are out there, and some are made by individuals or companies that may not be the best people out there. There are a lot of myths when it comes to probiotics as well. A lot of people ask me, hey, Dr. Islam, does different strains matter? And what I can tell you is that we don't have any evidence right now, whether it's a single strain, multi-strain, or particular strains are going to make a significant difference for the vast majority of people. We know that VSL number 3 is a great strain for individuals who have pouchitis or at risk for developing problems when they have surgery. We also know that lactobacillus and Saccharomyces tend to be the more common probiotic strains that are seen in the vast majority of probiotics, and some of the clinical studies suggest that may be beneficial as well. But we don't have a lot of good information for that. Nor do we know if the number or the amount of probiotics in a particular pill matters. We don't know if 1 million, 10 million, 100 billion actually makes a difference when it comes to improving your gut health when you take that. And also, we don't know if you have a probiotic that has multiple different strains that are out there, if that's going to make things better for you as well. We just do not know the answer to that. So a lot of these questions people ask me, unfortunately, we don't have a lot of good information. But if I have someone who comes to see me who says, hey, Dr. Islam, I want to try a probiotic. I understand what the risks are, and I understand that I may not benefit from that, as long as they're not on any type of immunosuppressive medication, and I don't have a reason for them to not be on, I'll say, all right, give it a shot, but know that you may not get any benefit, and know that it may be a waste of time and a waste of money as well. That's kind of my spiel on probiotics. I hope you guys got some good benefit from that.